Elsewhere, new research shows that 4 prominent vaccines are linked with a reduced risk of dementia. The vaccines are the RSV, the shingles, the Tdap, and the yearly flu shot. The findings support a 2022 study from the University of Texas that examined a database of nearly 2 million Americans ages 65 and older and found that those who received at least one flu vaccine were 40% less likely to develop Alzheimer's, the most common form of dementia, during the next 4 years. That certainly seems to be good news. And speaking of vaccines, as Health and Human Services Secretary Robert F. Kennedy Jr. works to rewrite vaccine policy on a federal level, several states are taking matters into their own hands. California, Oregon, Washington, and Hawaii have forged the so-called West Coast Health Alliance, coming together to issue their own recommendations on vaccines. And just this week, a leader of one of those states, Democratic Governor Josh Green of Hawaii, signed an emergency proclamation to protect vaccine access on the Hawaiian Islands, and the governor joins us now. We should also note he's a physician. Governor, thank you so much for being here. We really appreciate it. So let's just start with this. What sort of threat to the health of your citizens in the great state of Hawaii do the vaccine policies of Robert F. Kennedy Jr. pose?
It's a grave threat if we see a decreased access to vaccinations. And really what's coming out of Mr. Kennedy's shop, HHS, is confusion. And when people get confused, then they doubt what they're going to do with their bodies and with their families, and then they don't get their vaccination. So vaccination rates dip because of all the misinformation that he spreads, all of the chaos that's coming out of the CDC. And then we, as governors, end up dealing with outbreaks. So I decided I had to step in. I used my emergency powers to essentially say we are going to vaccinate our people. It was important because there were already some confusions about, can you get the COVID vaccination if you want it? Can you go and get vaccinated for measles, mumps, and rubella and varicella if you want it for your children? You can't have doubt. So I had to make sure that pharmacists can still give vaccinations. I'm so honored to be a part of this alliance with the other 3 Western states. These are great governors who care about their people. They don't want outbreaks. You're going to see outbreaks across America because of the policies that are coming out of HHS.
So more and more, as the federal government sort of cedes let me rephrase that, cedes sanity on health and on vaccines, it comes to blue state governors to pick up the slack. What kind of power do you have there, and how can you protect your constituents from this kind of sort of medical nonsense?
We have a lot of power. You know, we can still follow science. We can still follow evidence-based practices. And I would say this, it doesn't even just have to be blue states because, for example, you have a very thoughtful governor in Vermont who is extremely popular. He's a Republican, but his state has been very safe as far as vaccinations go. Vermont and Hawaii had the highest vaccination rates during COVID. We had the lowest mortality rates. So you can see if you follow science, you can protect your people. It ultimately doesn't have to be partisan, although it does play out that way, as you're correctly pointing out. All the states, and I spend time with all the governors, need to look out for their people. You're seeing very divisive policies come out of HHS. In fact, it was a bit shocking yesterday to even see Mr. Kennedy insert the women's reproductive rights question, the rights of RU-486 or mifepristone, into their debate. It's just terrorizing, in this case, women, but other cases, young parents, and it's not a place to be political. We should lead with our values, but then also follow science. It's one place we could possibly come together. And as you see, there is disarray at the FDA. Unfortunately, this is a pattern. You see also disarray at the Justice Department because there's too much divisiveness in the air and they're pushing too hard. It's time to back off and bring down the heat a little bit. But when it comes to health care, we have to be careful because this is the flu season. We're going to also see risks of other outbreaks like bird flu. They cut the research back on the mRNA vaccinations, which will also help us to deal with cancers. These are not good for humanity, these decisions, and I hope that they'll rethink them.
Yeah, and healthcare funding at the heart of this spending fight that may trigger a government shutdown in the days ahead. Governor, one other thing that Secretary Kennedy did, of course, in the last few days is this announcement about Tylenol and autism. He and the president appeared together at the White House on Monday. Just give us your thoughts on that specifically, but just the growing sort of reach, it seems like, from the secretary to put his hands in, all aspects of health decisions that individuals are making.
Well, he's on a personal mission to use his ideology, not science, to influence healthcare. There was no causality that was demonstrated from new research. That means they didn't have a clear cause and effect from Tylenol in this case, acetaminophen. It's not the right way to go about making health policy. It should be science-based. We should be doing research. Instead, they're cutting back on research. They're cutting back on public health. Parents are afraid. In fact, those who are in the community with children on the autism spectrum are pretty horrified that without data they're making these assertions, because then they don't know, are they to blame? Do they blame themselves? Do they feel betrayed? It's really actually quite tragic what Mr. Kennedy did with the Tylenol announcement. They're also self-promoting, Mr. Kennedy and some of his friends, and they're standing to benefit and to make money off of some of these decisions. And that's been also a pattern, unfortunately, for some in the administration. What I want to see is us come back together as Americans, and I also don't think this is healthy for the country or even for the president and the administration. I think he's hurting his own administration when 80% of people want to have access to vaccinations for sure, yet they're trying to scuttle that. We've seen so many examples of Americans being divided. Don't do it on healthcare. Don't do it when people are already struggling and suffering. Don't do it on people who are vulnerable in other communities. For people who have vulnerabilities, let's actually wrap our arms around them just a little bit and say we want to support you. But if we follow science, we don't have to fight so much. And so my plea is, in a deeply divided country, use this opportunity in healthcare to unite us. And it is possible.
Democratic Governor Josh Green of Hawaii, we should note, also in New York to appear at the Clinton Global Initiative on climate change issues. Governor, thank you so much.